Whenever you move a loved one into a nursing home or an assisted living facility, it can be stressful. I know. My mom was a patient and she suffered from Alzheimer's in the last years of her life. So I understand the toll it can take on you emotionally. You worry constantly. Will your parent or your loved one be adequately cared for while they are in the nursing home? Well, let me give you some chilling statistics on why you should be concerned about the quality of care right here in Georgia. According to a report by Atlanta's Fox 5 news station in November of 2017, 42% of Georgia's nursing homes are ranked below or much below average using Medicare's rating system. Their findings were incredibly disturbing. In one case, they discovered a patient found with maggots in their skin as well as stage 4 ulcers. Another patient was given a mixture of laxative and pine sol cleaner. The nursing assistant thought the cleaner was green tea. Well, the resident suffered burns to the throat and had to be rushed to the hospital. Okay, so we know there are many problems out there with nursing homes and assisted living facilities right here in Georgia. But this leaves us with two big questions. One, how can we spot neglect and abuse? And two, what do we do about it? Well, let's quickly talk about neglect and abuse. Neglect for a patient can include unintentional lack of care for existing medical problems or lack of attention to the needs of the patient. The patient may have bed sores, also known as pressure sores or ulcers, skin rashes, infections, dehydration, skin tears, significant weight loss, depression or isolation, wandering around outside of the facility. And you may be wondering, how can this happen? Aren't these nursing homes doing all they can do to prevent this kind of neglect from happening? Well, they should, but oftentimes many facilities are understaffed, or the people who are hired to work there are not properly trained nor supervised because the facility is cutting costs to save money at the expense of the patient. Well, according to a report by the U.S. Department of Health and Human Services, 90% of U.S. nursing homes are staffed at levels too low to provide adequate care. The Milbank Quarterly, which is a health policy journal, states that African Americans are 4 times as likely as white Americans to reside in understaffed and poorly funded nursing homes that offer substandard care. And this lack of training can lead to other problems, especially when it comes to providing proper medications. According to a report published in the American Journal of Medicine, nursing home residents in the United States suffer 1.9 million adverse drug effects each year. 86,000 of these are fatal or life-threatening. 70% of these mistakes were preventable. Now let's talk about abuse. Abuse happens in the nursing home and assisted living facility when someone intentionally does something or intentionally does not do something knowing that the patient would be affected in some way. Well, signs of abuse could include bruises, open wounds or welts, fear or anxiety, unexplained refusals or inability to communicate, disorientation, presence of unjustifiable physical restraint, prolonged or continual deprivation of food or water, elder reports of being slapped, pushed, or shaken, and injuries requiring emergency treatment or hospitalization. Well, now that we know more about neglect and abuse in the nursing home and assisted living facilities, what do you do if you have a family member or a friend who is a victim? Well, I encourage you to speak with me right now about the potential claim. The consultation is free. It's completely confidential. If it's a claim that we can handle, we're willing to give you our zero-fee guarantee, meaning there are no attorney's fees unless there's a recovery for you. I don't require you to pay me any money up front, nor do I charge you by the hour for phone calls, meetings, or any other legal work on the claim. You owe it to yourself, to your family that is the victim of neglect or abuse, to get the help that they need. So give us a call right now, 1-800-WIN-WIN-1 or 770-934-8000. You have absolutely nothing to lose by calling me. But think of all you can lose if you don't. Again, the number, 770-934-8000.